Knock, knock.
Come in.
Hey, Malcolm, good morning. My name is John. I'm going to be your nurse for the day. I am going to do your cardiovascular exam, peripheral vascular exam, and your respiratory exam. Let me wash my hands real quick and close the curtain for privacy. And so this video is going to be recorded. Is that okay with you?
Yeah.
All right. So I'm going to start with your cardiovascular exam. And before we get started, are you dizzy?
No.
Do you have any chest pain?
No.
All right, thank you so much. So with my patient in this position, I am going to start by assessing the precordium for any lesions, skin color changes, pulsations, thrills or heaves. And upon inspection, the skin color matches ethnicity. There is no lesions, there is no thrills, no heaves. So next I am going to palpate the precordium, and I am going to palpate the apical pulse, which is on the fifth intercostal space on the mid-clavicular line. So the apical pulse is right here. So the apical pulse is +2. I am now going to help my patient lay down in a recumbent 30-degree position with legs supported. And so with my patient in this position, I am going to start by inspecting the precordium. I am going to inspect for any skin color changes, pulsations, heaves or thrills. And upon inspection, the skin color matches ethnicity. There is no heaves, no thrills, and no lesions. I am then going to inspect for any jugular venous distensions, and there is none on this side. Could you turn to your left, please? There is none on this side either. So next I am going to palpate the carotid arteries, and I'll start with this side. And so the carotid, that's +2 right there. I am now going to auscultate the carotid arteries for any bruise. And I am going to use the bell side of my stethoscope. And then this side. There is no bruise on either side. I am then going to auscultate the 5 heart sounds. And I am going to start with the aortic area, which is on the right sternal border on the second intercostal space. I am going to use the diaphragm of my stethoscope. And under normal setting, this would have been right on the skin. But for purposes of this video, I am going to do it over the shot. So on the second intercostal space, I am auscultating the aortic area, and then move on to the pulmonic area, which is on the second intercostal space on the left sternal border, and then to the abs point, which is on the third intercostal space on the left sternal border, and then the tricuspid area, which is on the fourth intercostal space on the left sternal border, and finally the mitral area, which is on the fifth intercostal space on the mid-clavicular line. I am then going to listen to the same heart sounds by using the bell side of my stethoscope, and I'll start with the aortic area, which is on the second intercostal space on the right sternal border. I'll then move on to the pulmonic area, which is on the second intercostal space on the left sternal border, and then to the abs point, which is on the third intercostal space on the left sternal border, and then the tricuspid area, which is on the fourth intercostal space on the left sternal border, and finally the mid-clavicular line, which are the mitral area, which is on the fifth intercostal space. And upon auscultation, there is a regular rate and rhythm in all the 5 heart sounds. I am then going to move on to the peripheral vascular exam. And for the peripheral vascular exam, I am going to start by inspecting the upper extremity skin, and I am inspecting for any edema, lesions, skin color changes, and skin asymmetry. And upon inspection, the skin color matches ethnicity. There is no edema, there is no lesions. So next, I am going to palpate the upper extremities. I am going to use the back dorsal of my hands to palpate. So I am palpating for the temperature, texture, and moisture. And upon palpation, the skin is dry and intact, and it's warm to touch. So next, I am going to assess the capillary refills for all the 10 fingers. Can I have your hands, please? All right. Okay. And then this. All right, the capillary refills are less than 2. And then I'm going to assess the pulses for the upper. I am going to assess the pulses for the upper extremity. And I'll start with the brachial pulse, which is right here. And the brachial pulse is +2. I am then going to do assess the ulnar pulse, which is right here. The ulnar pulse is +2. And finally, the radial pulse, which is right here. So the radial pulse is +2. I am now going to observe the heart rate. So the heart rate is 74. I am now going to move on to the lower extremity skin. And for the lower extremity skin, I am going to begin by inspecting the lower extremity skin. I am inspecting for asymmetry, skin color changes or lesions, and upon inspection there is no asymmetry, skin color matches ethnicity, there is no lesions. I am then going to palpate the lower extremity using the back dorsal of my hands for any temperature, texture, and moisture. So upon palpation, the skin is dry and intact and feels warm to touch. So next, I'm going to assess for cup refills for all the 10 toes. All right, so the cup refills are less than 2 seconds. I am now going to assess the pulses for the lower extremity, and I'll begin with the femoral pulse, which is right around here. And the femoral pulse is +2. I am then going to assess the popliteal pulse, which is right here. The popliteal pulse is +2. I am then going to assess the dorsalis pedis pulse, which is right here. The dorsalis pedis pulse is +2. And finally, the posterior tibialis pulse, which is right here. And that is the posterior tibialis pulse is +2. So I am then moving on to the respiratory exam. Malcolm, could you please take a seat over there? And for the respiratory exam, before we get started, do you have any shortness of breath?
No.
Any trouble breathing?
No.
All right, so while I'm asking all these questions, I am observing for any retractions. I am observing the breathing effort, the breathing pattern, and upon observation, there is no retractions, no use of accessory muscles, and Now I am going to observe the respiratory rate for 15 seconds. So the respiratory rate is 15. When you multiply that by 4, it's equal to 60, which is within regular findings. So next I am going to inspect the posterior thorax. Could you please turn towards that side? So for the posterior thorax, I am going to begin by inspecting the scapula, the thorax, and the skin color. So upon inspection, the skin color matches ethnicity. There is equal rise and fall of the scapula, and there is no color changes. So next, I am going to palpate. The cervical spine, the thoracic spine, the scapula, the ribs, and the intercostal spaces for any masses or tenderness. Let me know if you have any pain, please. Any pain?
No.
All right. Okay. All right, and then I am going to palpate. Here for any. Could you take a deep breath, please? Deep breath again. All right, so there is no tenderness, no masses, and there is symmetric expansion. And so next I am going to palpate for tactile fremidas. Please, if you feel my hands on you, could you say 99?
99. 99. 99. 99.
All right, so tactile fremidas is equal bilaterally. So next I am going to listen, I am going to percuss for resonance in all the 10 spots. And this would be right on the skin, but for purposes of this video, I am doing it over the shot. All right, so there is resonance in all the 10 lung fields. So next I'm going to auscultate for bronchovascular sounds and vascular sounds in the first and second intercostal spaces and all the other spots. So could you take a deep breath for me, please? Deep breath. 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 All right, so all the bronchovascular sounds could be heard and the vascular sounds were heard in all the 10 spots. Could you please turn towards me? I am now going to inspect the anterior thorax, and I am going to inspect for skin color changes, lesions, and shoulder alignment. And upon inspection, the shoulder alignment is the shoulders are equal they're equal, and there is no skin color changes, no lesions. So next, I am going to palpate the anterior thorax. I'm going to palpate the clavicles, the sternum, and I am also going to palpate the ribs and the intercostal spaces. Please let me know if you have any pain.
No.
No. Okay. All right, so there is no masses or tenderness. Finally, I'm going to auscultate for the lung sounds in all the 6 spots and the first and second intercostal spaces. This would be right on the skin, but for purposes of this video, I am doing it over the shot. All right, so bronchovascular sounds were heard in all the lung fields, and the vascular sounds were heard. Thank you.